Hi guys, Dr. Garda here with part 1 of our series on can surgery fix your back problem? Okay, so that's a great question because over 90% of all of us are going to experience back pain at some point in our lives, right? Of that, just less than 5% are going to end up having a surgery. So that's a lot of surgery. So, 1, why are so many operations being performed? And 2, do these back surgeries actually fix the back problems? That's a good question, right? Because surprisingly, there's an enormous amount of back surgeries performed that don't give patients long-term relief. So the idea of pursuing less invasive care, before possibly pursuing a poor surgical outcome, might think about it, right? So this week we're going to talk about MRIs, patient outcomes, and what you can do about things. All right, so we'll see you in part 2. All right, part 2, can surgery fix your back problem? Okay, so of course, if you want to treat your back pain, we must identify what the source of the problem is. So between 1995 and 2015, MRIs and other high-tech scans for low back pain increased by 50%. But according to a lot of studies out there, up to 35% of these scans were considered inappropriate. Okay, so one scientist was quoted to say, quote, 90% of patients with low back pain will respond to things like medication and goal-directed therapy, right? And they don't need imaging at all, unquote, right? In fact, studies estimate that up to 30% of all healthcare spending is wasted. So when an entire course of care to fix a back pain issue in this office, costs less than one MRI, that's only going to tell you, exactly what the patient history, the exam, and the orthopedic tests have already confirmed. It just seems like we need to have a look at our priorities. All right, see you in part 3. Can surgery fix your back problem? Part 3. Okay, so failed back surgery syndrome is when you now have a new or a persistent pain after your spinal surgery, okay, for your back pain or leg pain. Unfortunately, we've seen a lot of this over the years, and what happens is that after the surgery, your pain might be reduced, but still be present, or sometimes your pain can actually get worse within a few months because after the surgery, scar tissue builds up around the nerve roots of your spine. And this can also go along with a persistent pain in the surrounding tissues along with muscle spasms. What people don't know is that this can happen even if there wasn't a problem during the surgery. So the surgery is a complete success, but we end up not getting the outcome that we're looking for. Okay, and the fail rate percentages for back surgeries might surprise you, and we're going to go over that in part 4. Okay, part 4 of our 5-part series on can surgery fix your back pain. So again, failed back surgery syndrome. It refers to a condition of continuing pain after a spinal surgery. While published reports estimate that the incidence of failed back surgery syndrome are between 20 to 40%, the likelihood is considered, of course, greater if you've had multiple surgeries. And the condition will be more prevalent in areas where spine surgery is more common. So that makes sense, right? So more specifically, when it comes to spinal fusions, studies have shown that fewer than half of all spinal fusions are successful, with up to 94% still having back pain after the surgery. And 20% of people need a follow-up surgery within 10 years. Right? So that's why we're really trying to, in this office, we want to encourage you to investigate less invasive solutions before you commit to a more invasive solution. Does that make sense? All right, part 5 tomorrow. Thanks, guys. Okay, part 5, can surgery fix your back problem? Now, if you've been following along this week, you know that we really do want to encourage you to get a second opinion if you've been recommended a back surgery. You only have one spine, and the healthcare decisions that you make today are going to affect your life for years and decades to come. Research has really shown that the majority of people who are suffering from back pain can find relief without surgery. And research has been continuing to show that chiropractic care is one of the most safe and effective options that you have on the road to relief. Okay, so we'll see you next week. Thanks, guys.